Hey y'all, Dr. Darria here with another episode of Ask Dr. Darria. So a lot of you have submitted your questions and I wanted to get to a couple of them that I thought were really relevant tonight. Of course, if you have other questions, I'm going to be answering these every week. So make sure to put them in the comment section. Let me know your questions or message me at Dr. Darria on Instagram and I will try to include them in next week's Ask Dr. Darria. So the first question I had was, can you comment on the WHO report on asymptomatic spread? Now, for those of you not familiar with it, the WHO came out with an announcement yesterday that they did not think that asymptomatic spread of coronavirus was that big of a deal. Of course, it caused a lot of questions and a lot of kind of whiplash that people seem to be having. Here's what I think. I think that the WHO is kind of airing their scientific dirty laundry here. Because here's what happens. Here's what happens in a normal situation, non-COVID. We have multiple studies. The multiple studies come in. We look at all of them in the totality of the studies, and we start to make conclusions. The WHO is trying to jump the gun and kind of report on something quickly without looking at the bigger picture. When we've had other studies that have shown that some portion of cases are spread by people who currently don't have symptoms. What the WHO was trying to make was a very nuanced difference that I think is mainly scientific and doesn't really matter in the real world. And that was they were trying to separate out people who are totally asymptomatic, meaning they never ever had symptoms of COVID despite having it, from people who are mildly symptomatic and maybe just didn't notice it. Maybe they had a runny nose or thought they had allergies, from people who are pre-symptomatic. That's the important category. People are pre-symptomatic means that we know you're contagious for about 24 hours before you develop symptoms. If you lump that whole group together, then we know that there is some proportion of COVID that is spread by that group of people who, at the time that I see you, when you and I are talking face to face, if you have COVID and you don't have symptoms, I have no idea if you don't have COVID, or if you're an asymptomatic spreader, if you're a mildly symptomatic person, or if you're just pre-symptomatic and you're going to get COVID tomorrow, which is why I think the WHO's difference and they were trying to make is scientific only. It's important for doing data collection and studies, but for us in the real world, looking at that one person who doesn't have symptoms, I have no idea if they're going to get symptoms tomorrow, which is why we should not change our behavior. You should not go out thinking that suddenly, oh, asymptomatic people can't spread it. Not true. Now, somebody else had said, are you expecting a rise in COVID cases after Memorial Day and with the protests? So I think that yes, some degree of rise is inevitable. And we're already seeing it. We're seeing in Pennsylvania, they have a case of an outbreak of people from one person who went to the beach in New Jersey. That New Jersey shore, you come away with more than you may have expected. Sorry, New Jersey. But then also we're seeing it from the protests related to protests. The Minnesota National Guard and the DC National Guard have both noted that they have had some officers who have now tested positive for COVID. Unclear if that was due to the protest or not, but it's, of course, any large gathering, a large gathering where there's lots of people, high density of people, and high degree of kind of aerosol creating activity such as shouting. Anything like that is going to be something that is kind of a high risk. So let's talk quickly about COVID in children. There was a new study that came out in children of just COVID in children. They looked at about 50 kids out of New York City and Italy. And there's just a couple of interesting things they found. One was that there was a shorter time span from symptom onset to admission. So on average, while adults are usually about 5 to 7 days from symptom onset to hospital admission, in kids it's around 2 days. Anywhere from 1 to 5, but on average it was 2 days. They did find that the number one risk factor for severe illness was obesity. About 22% of those children having obesity. And this is why we also need to take steps as we come out of the COVID lockdown to pay attention to childhood nutrition, childhood health. It is how you impact a child's health now. It's how you impact an adult for the next 80 years. If there's anything we can focus on and learn from this COVID situation, it is that. Some people had asked me, when can I go see my family? So this is important that we start talking about this because there are a couple of questions to ask yourself if you want to start socializing with your family members. One is, what risk level are those family members? If they're your parents, are they older? If they're above 70, they're in the high risk category. No matter how healthy they are, they're still in a higher risk category. Even more dangerous if they have chronic health conditions, obesity, diabetes, COPD, hypertension, heart disease, congestive heart failure. If they have those things, then I would not mix with them for now, because you're just going to be putting their health at risk. Separately, say it's not your parents, maybe it's your siblings and your children's uncles and aunts. Then the question is their risk and protection level matching yours? This is a really important question to ask, and I have seen so many families have some really emotional debates about this. I don't know what it's bringing up, but it's getting to some roots of some emotional feelings. If they're not, if you're a family that is very protective and still trying to isolate, and they're a family that is not, then it is okay. That is their decision. If you don't feel comfortable mixing with them, don't. You need to have a plan. Everybody needs to have this. If you are going out and starting to socialize, you need to have a plan for when you get that call. Because even if you don't get COVID, I think it's almost certain that everybody is going to get that kind of call sometime over the next 6 months. You need to have a plan. Know what that plan is going to be. Do you need to isolate? If you need to isolate yourself or your family, how are you going to do that? And then taking that plan one step further is if you were to get the call that you or someone in your family, immediate family, does have coronavirus and that you need to quarantine for 2 weeks. If you work, how are you going to handle childcare? How are you going to handle work? It's going to be much like the lockdown that we just had, potentially even stricter, because nobody in your family is supposed to be even leaving the house. How are you going to get food? Have a plan in place for for both of those things. The first of you getting a call that you may have been exposed, you're probably going to get that kind of call. The second that you or somebody in your family has COVID, hopefully not, but that could happen. So what are you going to do? Have that plan for how everybody is going to convalesce and lock down at home. So make sure you do that. Now, I want to tackle one other thing. I want to talk about how we look going forward, because up until this point, the decision was pretty easy. It was lock down, eliminate your risk of exposure to coronavirus. It's not so much anymore. People are starting to open up, some more than others. So the question of whether we should be opening up is moot. The nation is opening up. The question is now, instead of thinking of zero exposure, I want you to start thinking in terms of exposure dose. Exposure dose of the virus. Why does that matter? Because if somebody puts one little virus drop of COVID on you and you inhale it, you're not going to catch coronavirus, and you're not going to develop COVID-19. You have to be exposed to a certain amount. Exactly the amount, we don't know, but you have to be exposed to enough of amount to cross a threshold that you get infected and get sick by it, for one. And then secondly, there's some interesting research in the tuberculosis world and from the SARS research that shows that the lower the exposure dose that you get, if it's enough to make you sick, even if the dose of exposure is low, that means you are less likely to become severely ill. So what does that mean? That means that as we start to open up and go about our business, even if we acknowledge that we could potentially be exposed to coronavirus, because that is a good possibility, that even if you do, you want to keep that dose low.